Hi, I'm Stuart from Stuart McFarlane Optometrist. If you suffer from diabetes, one of the major potential complications is diabetic eye disease. There's two main risk factor groups with diabetes. The first are modifiable risk factors and the second non-modifiable risk factors. The modifiable risk factors are things such as your sugar control, blood pressure and cholesterol. And it's essential to have all three of these in tight, good control to minimise your risk of developing diabetic eye disease. Non-modifiable risk factors are the duration of diabetes. In other words, the longer you've had diabetes, the greater the risk you have of developing complications. Diabetic eye disease can take several different forms. You can develop double vision, you increase risk of glaucoma, cataracts, but the primary number one thing that everyone's concerned about is diabetic retinopathy and diabetic maculopathy. Diabetic retinopathy is where bleeding develops at the back of your eye. This occurs because the blood vessels become more leaky with diabetes and as time progresses. The second thing that can occur is diabetic macular edema, and this is associated with diabetic retinopathy. It's where the macula, which is the part that you see with, has a leak in it. If you develop diabetic macular edema, you may find that your vision becomes a little bit blurred, and you may find that lines that you know are straight don't appear straight anymore, but they appear to have a little kick or a kink in them. And this can be some of the signs of diabetic macular edema. The way of definitively diagnosing the condition is for you to come in, we'll put drops in your eyes to dilate your pupils, then we'll take retinal images of the back of your eye. We'll then put you on an OCT, which is an instrument that's operating on lasers, and it gets a cross-section through the back of your eye, similar to an ultrasound. And this way we'll be able to see if there's any swelling of the retina at the back of your eye. So the important thing to remember is that if you have diabetes, it's essential that you have your eyes checked annually. And each time you have your eyes checked, you'll need to have drops in to dilate your pupils so that we can have a good look around the back of your eye. If you have diabetes, come and see us at Stuart McFarlane Optometrist.